Hello, I'm Daniella Holland-Hart, and I'm going to talk about the PLUS study, which is a pharmacy referral service for lung cancer symptoms. This study was conducted by Hywel University Health Board and the Division of Population Medicine, Cardiff University. As background to the study, the UK lung cancer survival rates are amongst the worst in Europe, with higher mortality in more socio-economically deprived areas. The one-year survival rate is 38% across England and Wales, with only 17% of lung cancer patients receiving surgery for curative treatment. The study aimed to develop a fast-track community-based pharmacy referral service for chest X-rays to encourage earlier diagnosis of lung cancer in an area with high levels of socio-economic deprivation. Also, it aimed to assess the feasibility and acceptability of the pharmacy referral service and to develop awareness campaign ideas to encourage people to go to their pharmacies with lung cancer symptoms. The pharmacy referral service for lung cancer symptoms pathway included the following. Pharmacists identified eligible individuals for the service based on one or more unexplained cancer symptoms according to NICE guidelines. Then, the patient was consented to the study and participated in a private consultation with the pharmacist. If eligible, the patient is then referred for the chest X-ray. Patients could then access radiology for a chest X-ray after 2 working days at their local hospital. The patient would then receive results of chest X-rays from the hospital via a letter. If the results were positive, they would be sent on to the Rapid Access Lung Cancer Centre. Methods used in this study included quantitative and qualitative data collection and analysis. Quantitative data were collected on patients that used the service. This included questionnaires which were completed by pharmacists, including patient characteristics and pathway variables, for example, the number and outcome of chest X-rays. Qualitative data included interviews and focus groups, which were used to explore the views and experience of the service. Topics included the acceptability and feasibility, barriers and facilitators to implementation, and uptake of the service. Also, recommendations for relevant campaign strategies and materials. Participants were recruited through Healthwise Wales, poster campaigns, local health board links, face-to-face recruitment at community venues and pharmacies. Participants recruited to this study included 12 patients that went through the pharmacy referral service. These were all male. 4 patients were also interviewed. 7 pharmacy professionals were interviewed, including pharmacists, counter staff, and a technician. A general practitioner was also interviewed. 4 focus groups took place, including one with healthcare professionals and 3 with members of the public, including smokers and former smokers. In all, there were 6 healthcare professionals included in the focus groups and 13 members of the public. The main results of this study included that no cases of lung cancer were detected, but 1 patient was diagnosed with a rare lung condition, pulmonary fibrosis. Patients waited on average 3 days for their chest X-ray, but an average of 46 days to receive chest X-ray results. Participants considered the pharmacy referral service to be acceptable and the pharmacy element to be mostly feasible, but discussed areas for improvement before wider implementation. This included improving the time taken for secondary care to provide the results to patients. Perceived barriers to uptake of the service included concerns about the credentials of pharmacists to deliver the service, as well as low awareness of the service within the community. Facilitators included trust, approachability, and ease of access of pharmacists relative to other healthcare professionals. A well-publicised, targeted, multifaceted awareness campaign emphasising the availability of the service, the capacity of pharmacists to refer, and the speed of referral was highlighted. Participants described the need for positive campaign messaging in order to overcome fear of using the service and be diagnosed with lung cancer. Preferred methods of publicity included using inserts or stickers on pharmacy bags, posters, word of mouth, pharmacy delivery drivers, and healthcare providers' telephone messaging service. Overall views of the pharmacy referral service were expressed in the following quotations by participants. A pharmacist that was interviewed stated that they thought, "I think it's a good idea. It's a good way of getting to the people who don't tend to go to the GP as often." A patient that was discussing their experiences of the service, particularly in relation to the fast-track nature of it, stated that the initial service, fabulous, but you cannot call it aftercare because I've not had the aftercare. The pharmacist was extremely helpful. I found the whole fast-track system exceptionally efficient. Another patient, when discussing their ideas about the credentials of the pharmacist, stated that, "I think in the back of my mind, I was more likely to have gone to see the doctor, or probably I would not have gone to see the pharmacist, because I would not have thought of them being able to recommend me to go and get X-rays. I suppose having some kind of certificate that sort of states this pharmacist is able to refer." Public focus group discussed their ideas about an awareness campaign and expressed the best ways in which they felt that the service was able to be promoted in their community. The first participant stated, "If it's a local campaign, then insert medication bags in the windows of pharmacies themselves, in the doctor's surgeries." Another participant stated, "Some of the people are high risk, so you can target them and get them to try and go and see them." The main conclusions of this study included that a community pharmacy referral service was acceptable as an alternative pathway to symptomatic diagnosis of lung cancer in deprived communities. The service was considered broadly feasible, but required improvements, particularly in secondary care delivery, before wider implementation. This included patients receiving their results far more quickly. Also, it was felt that standardised training for primary, pharmacy and secondary care staff is required to ensure optimum delivery of the service. And a multifaceted, targeted campaign to promote the service in the community and healthcare settings is required alongside the service in order to promote it. Thank you very much.